All right, Georgia, we're just going to go through your assessment for your balance assessment, your static postural assessment, and your functional movement assessment. So, Georgia, a few things that have come up are your ankle presented with supination in the left ankle and pronation in the right ankle. Knee, you exhibited genu valgum, so knock knees in both knees, so your knees kind of cave inwards. Pelvis and anterior pelvic tilt was observed. Lumbar spine, you have lordis, indicating an exaggerated inwards curve of the lumbar spine. Thoracic spine, there is no evidence of kyphosis or rounded shoulders. Scapula, you had no winging that was noted. Neck spine, forward head posture was identified, so you pushed your head forward. Observations, no signs of upper cross syndrome or lower cross syndrome or prostrated distortion syndrome were noted. And you had no pain that was reported in any of the joints assessed. Your functional movement assessment, squat pattern, all criteria were met, indicating sound movement competency. Split squat, you met all the criteria with your left leg in the front position, though your right leg, you had issues with shoulder and pelvic alignment, ankle, knee, hip alignment, and ankle neutral. Ankle neutral. Hip hinge, you showed good movement competency, but could improve the trunk parallel position. Banded row, you performed well in this test with a minor need for improvement in the scapular retraction. High-low row, good performance, though scapular retraction and depression required attention. Push-up, several areas need improvement, including elbow angle, shoulder position, and neutral spine. Overhead press, all criteria were met except for an upper arm alignment with the ears. Trunk rotation, while you maintain the neutral spine, you need to work on equal rotation through both sides. So Georgia, you scored a 2 on multiple exercises indicating movement dysfunction. Corrective exercises have been prescribed to address these issues. Balance assessment. Georgia, you participated in the standing balance test. So on the left leg, the first time your average was about 30 seconds, and on the right leg, your average was 20 seconds, which is a fairly good result. These results indicate that you have a slight imbalance between your left and right side, particularly in your right leg, which may need strengthening and stability work, which could be doing single leg movements like single leg half squat or single leg press or step ups. So your squat pattern correction on the right leg front. So hip mobilization, pigeon stretch. Lateral hip activation, banded crab walks, movement progression, banded assisted split squats, hip hinge pattern corrections, hip mobilization, hamstring sweeps, posterior hip activation, glute bridges, erector activation, Supermans. So these are just stretches and exercises that you can complete if you understand all that. Yep. Horizontal push patterns correction, scapular control, trap raises, movement progression, incline push-up, vertical push correction, shoulder mobilization, side lying windmills, thoracic mobilization, foam roller, scapular control, kettlebell bottom-up press, trunk rotation, thoracic mobilization, side laying rotations, movement progressions, Russian twists. So Georgia, in summary of all this, you have demonstrated good functional movement competency in several areas, but there are specific postural and movement imbalances that need correction. The prescribed corrective exercise aims to address these issues and improve your overall functional movement, stability, and balance. Regular reassessment is recommended to monitor your progress and adjust the program that you're currently doing as needed. So I'll send you our full detailed report and the exercises with pictures and videos attached so you can understand. But otherwise, you did a great job.
Thanks.